You're listening to Risk and Resolve. And now for your hosts, Ben Connor and Todd Hufford.
Welcome back to another episode of Risk and Resolve. I'm Ben Connor alongside Todd Hufford. And today's guest is Wendell Potter, President and Editor-in-Chief for the Center for Health and Democracy, as well as Healthcare Uncovered. Wendell Potter is a leading advocate for the healthcare system reform in both the political arena and the marketplace. Working dual roles, Wendell is the president for the Center for Health and Democracy. He regularly engages across the political spectrum to discuss health insurance issues with members of Congress, state legislatures, and their staffs. He is also the editor-in-chief of Healthcare Uncovered, which investigates and reports on healthcare corporations and insurance conglomerates in particular. He frequently posts on X. A New York Times best-selling author, Wendell returned to his first career of journalism after serving for 2 decades as head of communication for 2 of the country's largest insurers, Cigna and Humana. He became an industry whistleblower when Congress was debating what became the Affordable Care Act. Wendell testified before several Senate and House committees, pulling the curtains back on prevalent industry business practices that resulted in higher healthcare costs and a growing number of uninsured and underinsured Americans. His first book, Deadly Spin, won numerous awards and is still used in journalism and health policy classes at universities across the country. He's contributed to the New York Times, the Washington Post, USA Today, and many other publications, and has appeared frequently on CNN, NPR, MSNBC, Fox Business, and other media outlets. Wendell, thanks for joining us today.
No, my pleasure. It's good to be a part of your show. Thanks so much for asking me.
Yeah, and I didn't even mention that you were part of the documentary, It's Not Personal, It's Just Healthcare, which we had the joy of being a part of that project alongside you, which was wonderful storytelling of kind of what's going on.
It was a great documentary. I was honored to be asked to participate in that, and thanks for your role in that too, Ben.
Yeah, well, before we dive into all things healthcare and otherwise, Wendell, give us a little bit of background about you, where you grew up, and kind of your aspirations of getting into the work world. How did that start? Or did you always know that you wanted to be in the insurance business?
I doubt that any kid has that ambition, right? Can't imagine. I certainly didn't. And being a kid in East Tennessee, I grew up there in the mountainous part of Tennessee, in a very rural area. I grew up in small towns in that part of the world, and we weren't very prosperous. My family. Many of my relatives were farmers, as my dad and mother were, but my dad took a job at a factory when I was 6 years old, and we left our rural community and moved to Kingsport, Tennessee, where Dad got a job and worked at a glass factory for about 25 years. So I've got my background is in rural America and working class America, but Mom and Dad. They never had much of an education, but they saved whatever they could to try to make sure that I would have a better education and hopefully a better life and better career. And I was able to go to the University of Tennessee and kind of fell in love with journalism while I was there. I became the editor of the student newspaper at the University of Tennessee and got a job right out of college working for a pretty sizable big city paper in Memphis, and then got a chance after a couple of years of covering local things, of being sent to Nashville to cover the Tennessee legislature and the governor's office, and then just as luck would have it, I was promoted to Washington and went to Washington to be a part of the Scripps Howard News Bureau, and I covered the Congress primarily, but also the White House, Supreme Court every now and then. So I had a great career in my 20s, actually. I I was very fortunate to be able to get to Washington as early as young as I was. I was the youngest member of the bureau, but I ultimately decided that I wanted to, as I've sometimes said, be a participant rather than just a reporter of news and events. And I made the switch. To be honest with you, I knew that public relations and communications work outside of journalism paid more, and so that was a motivating factor. And it's true. So I left journalism and could not have envisioned a career in health insurance. My first job in healthcare was hitting marketing and public relations for a fairly large regional healthcare system in East Tennessee, and it was the East Tennessee Baptist Health System. And from there, I went to Humana and experienced right off the bat the differences between so-called nonprofit healthcare and big-time for-profit healthcare.
Yeah. And would you, so, and we'll get into the goings on and inside of a health insurance company, but I mean, your love is communication and journalism. When you were in the insurance company, I mean, has it always been journalism and communication, or at some point in that experience, did you become like, actually an insurance expert and caring about the thing of insurance? I don't know if that's the right way to ask that, but
Yeah.
like you became the subject matter expert of the thing rather than just a communications expert, right?
It is true. I was given um, unusual access to a lot of people in the company, including the CEO and the CFO. I worked with both of them very, very frequently. The investor relations team, my name was on Cigna's earnings reports, quarterly earnings reports for 10 years. I worked very closely with the chief medical officer and all of our medical directors around the country. Other members of the executive team, our lawyers. I was actually a part, while I was at Cigna, of the legal and public affairs team. So not only did I handle financial communications, but I worked very closely with the lawyers whenever there was any litigation involved or any legal matters that needed to be addressed. I was called in for that. But also as part of that, the public affairs part, my team and I supported our lobbyists in Washington and around the country. We wrote the talking points for our lobbyists. We briefed them on what the company's business strategies were and what the expectations were for public policy, particularly in Washington, but also in the states. So I had unusual visibility into the industry and the company. I also was Cigna's representative at a lot of trade associations like AHIP, America's Health Insurance Plans, and a lot of groups that were formed over time by the big companies to try to influence either public opinion or public policy or both. And usually it was both.
So so going back to getting launched you were hired by Humana, getting into the health insurance world. What did it look like? And you even said it was much different from the nonprofit side, right? So maybe let's start there. How was that difference palpable to you?
When I first went to Humana, and in fact, I was recruited to Humana to manage communications for the hospital division, which at that time was the largest division. Humana was largely known as a big hospital company. And I, having worked for a fairly large regional healthcare system in Tennessee, I had familiarity with how hospitals operate. But what I saw at Humana was a different beast and a priority on profits. My office was right across the hall from the investor relations team. So I learned pretty quickly that the top stakeholder for that company and for other for-profits, whether it's hospitals or insurance companies, is a shareholder and a handful of Wall Street financial analysts that I became very, very familiar with over the course of my career. While I was at Humana, the company decided to spin off its hospitals and to devote its resources and attention on health insurance. And so I was there. I was the head of communications for this new version of Humana that did not involve ownership of hospitals. They were spun off. In fact, the hospitals were sold to an entity that was ultimately bought by now Senator Rick Scott from Florida. And he combined them when he went to HCA, and the Humana hospitals became largely a part of HCA. But it's very, very different. Very different world. And the executives at Humana certainly were paid considerably more than the executives at East Tennessee Baptist Hospital. I can assure you that. I can remember very vividly being on an elevator early on in my time at Humana with one of my colleagues, and then someone got into the elevator on the executive floor in a full-length mink coat, and this was a gentleman. He was forgotten his. I think he was the chief operating officer of Humana at that time, and I decided to introduce myself to him, and I said, "Hi, I'm Wendell Potter. I'm in public affairs," and he said that that's just what we need around here. Someone new in public affairs to screw things up around here. But he didn't use the word screw. It was kind of eye-opening. The company was very, very successful. Among the things that I did during the times when the company was focused on hospitals was managing a lot of news media reports about how the hospitals overcharged, the high cost of hospital goods and services at Humana hospitals. I learned a lot and worked with a lot of national media during that time. And then I managed, as I said, communications around selling the most prominent division of the hospital so that the company could focus on insurance and in particular on what would become Medicare Advantage. Humana has long been a player in the Medicare space, and in fact, as you undoubtedly know, in the recent past, the company's decided largely to get out of the commercial health insurance business to focus on its Medicare business.
Right.
What was the first year you were at the insurance side? I think that'd be Cigna. What year would that have started?
I started at Cigna in 1993. I was recruited from Humana, and Cigna was a very big multi-line insurance company at that time, and the healthcare operations were based in Connecticut. The corporate office was Philadelphia, and I was hired to manage communications around our health plans, particularly in the West, where we had a fairly significant business, and Cigna still does, to my knowledge, in California and Arizona, New Mexico. So I had that was part of my responsibility, was to handle the health plans out in the West. But while I was there, I was made head of communications for all of Cigna's works healthcare operations. And then in 1997, I was promoted once again, and this time had to move to Philadelphia, where I still live, to be vice president of corporate communications for the whole corporation. Which included, at that time, a property and casualty division, a financial services division, reinsurance division, and some others that the company ultimately decided to sell. But that was my first time working for Cigna, initially for 4 years in Connecticut, and then working for the whole corporation as VP of communications beginning in 97.
And what year did you then start at Humana?
89. I started to work at Humana in 1989. It seemed like a very, very different world, and I was a very much younger man. But it was a time when not very many companies were in the Medicare business. I mean, Humana was one of the, as I said, it was one of the early companies in the Medicare space, and had a big presence in South Florida in particular. So I learned a great deal about not only commercial health insurance, but Humana at that time had some commercial business, but its main focus was on Medicare.
Did they have a commercial health side at that time?
They did. It was fairly relatively small. And one of the reasons that Cigna appealed to me was it was a bigger company, had a much bigger presence in commercial health insurance. Cigna has tried off and on to make some money in the Medicare space, but has got into it 2 or 3 times and got out of it 2 or 3 times. So I learned a lot about how that business operates just from working for those two companies. But Cigna had a substantial commercial business, and most of its business was it was a third-party administrator, TPA, for a lot of very big companies, and that's where most of the company's revenues came from. So the company serving as a TPA.
So 1989 seems a while ago, but not too terribly long ago. I can remember sitting at our kitchen table, being a young tyke, hearing my parents talk about insurance premiums, believe it or not.
Yeah.
And I saw some paperwork maybe a few years later than that, and the dollars were very, very small. And I've even seen some paperwork here in the office. You know, Ben and I came into the business in the early 2000s. We inherited a lot of paper, and there was old paper that we would see, proposals and policies, and the numbers flabbergasted us. So thinking back to those early years at Humana and even at Cigna, you were dealing with commercial policy premiums that were affordable. They were
Yeah.
within reach. Now, we still have hospitals. We still have insurance companies. Believe it or not, we still have cars. You know, we don't have the flying cars yet. So we still have the infrastructure in place that we had back in 89. Is there something you can succinctly point to or put your finger on and say, Todd, the difference between 1989 and 2019 or 2029, this is what's the big difference in the system that's causing your premiums to be 10 or 15x what they were in 1989, knowing that inflation is part of that, but there's a
Sure.
much different component of that.
There really is, and 2 or 3 things. One I will mention is that even though I worked for Humana and Cigna, and they were and still are two very big publicly traded companies in the insurance business. Most people got their coverage through nonprofit Blue Cross plans at that time still. Relatively few people were enrolled in a Cigna or Humana or United plan. Very few people had ever heard of United back then. And it wasn't until the 1990s, maybe close to the mid-1990s, when the first Blues plan converted to for-profit status. That was Blue Cross of California, now called Anthem Blue Cross. And then other Blues decided or began to convert to for-profit status. Many of them wound up under the umbrella of what is today called Elevance, a big health insurance company that comprises Blue Cross plans in 14 states. So I would point to that as a very important turning point for most folks, because while the executives of Blue Cross of California were saying that the company was on the verge of bankruptcy, they really wanted to convert to for-profit status because the executives were going to get a windfall, and they did when that conversion happened. I think that made a significant difference. What I learned in my 20 years working for these big companies and for the industry, again, is the slavish devotion to shareholders. Nobody is more important than the shareholder, except possibly from time to time Wall Street financial analysts who write reports on these companies and have such significant influence over how they are perceived on Wall Street. The reports they write can send a stock soaring or into the cellar. So that became abundantly clear to me, especially when I took over the financial communications responsibility, of just how much attention is focused on making sure that shareholders are happy more than any other constituent. So I would point to that, and I would point also, while I was at Humana, it was while I was there, Bill Clinton became president, And as you know, there was a big push to get healthcare reform enacted during the early days of the Clinton administration. Hillary Clinton was tasked with the responsibility of leading that. And I was very much involved in monitoring that, working with our lobbyist, first at Humana and then at Cigna, and played a considerable role in making sure that that legislation never got a vote and never got a final vote. So it obviously never was enacted. One of the things that we said at that time, we being in the industry, was just let the government get out of the way, and pretty much leave it to us. We will bring down cost. We will bring people into coverage. And politicians bought that. They bought our propaganda. Clearly, the companies that I worked for and the others that were the big four profits at that time were very concerned about any kinds of reforms that might have hindered their profit making. And so we were very much involved in efforts to kill it. I worked with the Health Insurance Association of America, which no longer exists. HIAA was the entity that was behind very effective TV advertising featuring this married couple, Harry and Louise, that scared the bejesus out of people by saying that the this and that about the Clinton plan would do this and that, and it was an extraordinarily effective campaign to get people to think that the Clinton plan was absolutely not in their best interest. So that was my first time of working in the big times, trying to defeat really important legislation. But that was also a turning point, because that really did it was a signal for, or a time when policymakers in both parties said, okay, we'll just turn it over to these guys. We'll see what happens. There certainly has been considerable regulation of health insurance companies at the state level in particular, less so at the federal level. But the companies, I soon learned, spent enormous amounts of money to influence elections and public policy in one way or another, often in dark money campaigns, and just enormous amounts of money that was spent. And one of the things that my team did was also dole out campaign contributions. So I saw how that works. These companies are incredibly well connected politically. They're very bipartisan. Their giving will be based on how the political winds are blowing. Some years they'll give more to Democrats than Republicans, and other years just the opposite. But they have a lot of politicians in their back pockets.
Wendell, what's different between the final outcome of what got put into place with Obamacare versus what was drafted for Hillary Care? They must have been starkly different, because it sounds like the plans, maybe even the hospitals, were against a lot of the Hillary Care provisions. But from what we witnessed, it seemed like they were pretty much for the Obamacare. You reported heavily on Hillary Care. I know you followed the Obamacare. What were some of those big differences?
The Clinton plan, one of the main features of that was something called managed competition. And it was a concept that, in other words, there would be kind of regional centers of health insurance, or there would be in which insurance companies would compete on more or less a regional basis. In is referred to as managed competition. There would be some further regulations on insurance companies, and initially the concept was supported by the insurance industry, but they began to be concerned that as the Clintons were rolling it out or proposing it, it wasn't exactly what they had in mind. It came out of something called the Jackson Hole Group, which was a group of executives and policy experts that met to try to come up with a new way for healthcare to be organized in this country. And the Clintons were enamored with that. That became the basis of what they wanted their plan to be. But it became a very unwieldy thing with many, many different parts. And whenever you have a big piece of legislation like that, or Obamacare, uh, you'll attract industry opposition. And you're right, the hospital industry, the pharmaceutical industry, as well as insurers were unified in their opposition to that. I spent a lot of time with an organization called the Healthcare Leadership Council, which still exists in Washington, and it comprises the biggest companies in pharmaceuticals and health insurance and hospital business. The Mayo Clinic was a member, probably still is, and I would meet often at the HLC offices in Washington, and we would coordinate our attacks on the Clinton plan. The Affordable Care Act, or Obamacare, I think the Democrats thought they had learned a great deal from the way industry reacted to Hillary Care or Clinton Care. So it was quite different. And Obama decided to try to work with industry groups from the beginning. He had soon after he was inaugurated in 2009, brought industry executives to the White House for kind of a kumbaya kind of thing. And all the representatives of the big parts of healthcare pledged that they would work with the administration and Congress on reform. But I knew that was disingenuous. In fact, before I left Cigna, one of the things I was doing was was participating in a plan to try to torpedo the Obama plan. What Obama did, he cut one of the first deals he cut was with the drug companies, and that got them more or less, if not supportive of the legislation, at least not attacking it. But interestingly, the lobbyist who was at the White House more than any other entity or part of healthcare was the lobbyist for the American Hospital Association. So the hospitals got some of what they wanted, or a significant part of what they wanted out of reform. The insurance industry did not like that legislation and tried to stop it. When they couldn't, they resorted to figuring out how they could influence big parts of that legislation to make sure that it wouldn't be too punitive for the companies in that industry. There were some things that went away that even Cigna didn't like. In particular, the law largely outlawed limited benefit plans, and Cigna and Aetna and some of the other companies had invested quite a bit of money in these plans, and they went away to a large extent. But ultimately, these companies have made a lot of money since the Affordable Care Act was passed. I've often said these companies know how to do one thing, that is to make money. And with all the lobbyists and lawyers that they have, they can sniff out a loophole from 100 yards, and they knew exactly what they were doing. And it went back to in 2003. You probably know there was a bill that was passed, a very significant bill called the Medicare Modernization Act, and that is the bill that created the Part D program for prescription drugs for the Medicare program, but it also revamped the Medicare program, and that's when the name Medicare Advantage was born. The companies figured out pretty quickly how to game that law as they learned how to game Obamacare. In particular, I think one part of Obamacare that was well intended, but has certainly been gamed, or at least taken advantage of, is the provision that requires them to spend 80 to 85% of premiums on healthcare. As it was implemented, the definition of what is healthcare was pretty broad. But I think looking back at it, one can say that probably also gave these companies an incentive to venture beyond health insurance, to get into healthcare delivery, because healthcare delivery is exempt from the medical loss ratio provision of the law. So they have grown like weeds since the Affordable Care Act was passed. The big ones anyway. United Health is now the third largest company in America by revenue. CVS, which owns Aetna, is right behind it. Cigna, the last I looked, was way up the list. I think it's number 13. So these companies have grown massively bigger as they have diversified. They had, like I said, when I joined the industry, they were multi-line insurance companies, but their operations were very diverse. Now they're all healthcare for the most part. Not all, but for the most part, they're healthcare, and they have figured out how to make money hand over fist. The way they've gamed that Medicare Modernization Act bill, prior to that, a lot of companies were, is prevalent in the industry. For the Medicare business, companies were not too keen on signing up people who might have pre-existing conditions or any kind of health condition. So they went out of their way to try to avoid enrolling people with health issues. And they were often, when they found that they had people who were enrolled who did have health insurance, had health issues, they'd get rid of them. It was called cherry picking and lemon dropping. It was very prevalent in the industry. So the 2003 law sought to address that by saying, well, the government will give you more money for sick people. If you enroll, if you will stop that practice, we'll give you more money, and that will further the privatization of the Medicare program. That was the objective of the Republicans in Congress and the White House at that time. And the industry said, sure thing. And they have gamed that incredibly, to the tune of about, not only do they make a lot of money, but they're overpaid by about $85 billion this year alone. That's an estimate by MedPAC. So these guys know how to make money. They know how to make money. They know how to take a law that on the surface seems to be punitive and find ways to make hay.
So, Wendell, thanks for that, and thanks for the outlay of what you saw there. Can you take us on the journey? You are head of communications, an executive at Cigna. You mentioned the word like propaganda. They took the propaganda, and you're in charge of communicating to all different aspects of the industry. But then you end up testifying in Congress and in front of the Senate as a whistleblower.
Yeah.
So the journey, you were on this journey, and then you ended up doing this part. So,
yeah.
Something happened in between those two things. So for you personally, what was that journey between those 2 points for you? And if you could explain
Sure.
that part of it in your story.
I think I probably wouldn't have done it had it not been for two of those things that I mentioned earlier about my upbringing and my first career. I was raised in a very poor and remote part of the country, where a lot of people didn't have health insurance, didn't have access to health care, where health outcomes are, to this day, worse than most parts of the country. But I was also a journalist, and as a reporter, I always tried to be objective and never to knowingly mislead people, never to leave something out that was important for a reader to have the whole picture. But I came to realize that that's precisely what I was being paid to do in the health insurance business, was to mislead people, was to leave out important details, and to get people to think that insurance companies were an essential part of the healthcare system, that the industry was committed to being solution driven, and one thing in particular that I began to question my own PR, if you will, was being tasked with the responsibility of communicating what we referred to as consumer-driven healthcare back in the early 2000s,
Mhm.
and it essentially was a euphemism for um, high deductible plans, and we were pretty savvy at how we sold these plans. And I began to be concerned about what I was telling people, because I knew that in many cases, as I was seeing my company and others implement these plans, that they were not good for people who were not in the best of health and who didn't have a lot of money. But the whole industry was trying to move as many people as possible, as quickly as possible, into these plans. And that began to concern me a great deal. I could certainly see how these plans would benefit insurers like Cigna, uh, because they would be paying fewer claims. Um, but we're seeing today that in many ways, I was right, because many people who are in these plans can't afford to use their coverage because they just don't have enough money to pay what they're required to pay out of pocket before their coverage kicks in. And for those who have no alternative, they often wind up in medical debt. It's been reported that we have 100 million Americans who have medical debt. And the vast majority of those folks have health insurance, but sadly, they're in plans that require them to pay more than they can afford to pay out of their own pockets. So I began to question what I was doing, but it really would take a trip back to Tennessee to visit my family uh, to have what I've often referred to as a conversion. I grew up in a Baptist church in Tennessee, and uh, faith was always a big part of my life growing up. And I went, while I was visiting my parents, I picked up the paper and read something about a healthcare expedition that was being held a few miles away from Kingsport, where my parents and I lived, or where they still lived. Um, there's this pop-up medical clinic, and they called it an expedition, that was being held at a nearby county fairground. And I was intrigued. It got a front page story. It said this had been held every July for 9 years, and people were driving from hundreds of miles away to this little place in Southwest Virginia called Wise, Virginia. And I borrowed Dad's car and drove up there out of curiosity. I've said, looking back, that road, Highway 23 from Kingsport to Wise, was my road to Damascus, because when I got there, when I went inside the fairground gates, I just saw something that was almost electrical to me. It felt like I really had gotten an electrical jolt the moment I walked in and saw hundreds of people in lines throughout the fairground, many of them leading to a barn and animal stalls where volunteers had been working to clean up as much as possible, but there were examining rooms in animal stalls in this county fairground. And it just did something to me. It was almost like I immediately understood that I had to take some responsibility for what I was witnessing, because of the work that I did to obscure so much important information from people. Um, people I could have grown up with, people that I could have been related to, were having to get care that way. And I learned out later, a few minutes later, a few days later, when I called the organizers, and I said, was asking them some questions, and they volunteered to me that a lot of people who were showing up at their clinics were in high deductible plans, and they just could not afford to go to the doctor or get the care that they needed, because they just didn't have enough money. And I was that really affected me, because
Oh,
I was a big part of my responsibility was to try to persuade people that this was great for everybody. Uh, and I realized that had I not been lucky, if my parents hadn't saved and let me go to college and get a good education, have a good career, I could have been one of those folks in one of those long lines. I still work. I still go to some of those clinics. It still goes on. In fact, there are more of them now than ever before because there still is such a great need. And I talked to the organizers recently. I was on a panel with them, and they had one of their expeditions in Erie, Pennsylvania, not so long ago. And he, the CEO of Remote Area Medical, which is the outfit that puts these on, said that 70% of the people who were there have health insurance.
Wow.
So that's an indictment of our health insurance system, if you ask me.
Absolutely.
We're paying more than any other country in the world on healthcare. Premiums go up every year. But I still pay attention to the profitability of these companies, and they're doing quite well, very well. Last year, the 7 largest publicly traded companies made about $71 billion in profits. So they have a lot of money. They have a lot of money.
Yeah. So what's the journey you're on today? So you had your Damascus Road moment, and you're speaking out about like, hey, I saw the inside of this thing, and it's as you would expect. It's a money machine that cloaks itself as a health insurance company. So what's the journey that you're on? As you said, goodbye to that former life, and you look to solutions of healthcare and writing about it and otherwise. What are you excited about? Like, what is the journey you're on today?
Well, it's an interesting journey, one that I never could have imagined. Never could have imagined working in the insurance industry, and I couldn't imagine at any stretch of the imagination doing what I'm doing now. Of being able to return to journalism through my newsletter, Healthcare Uncovered.
Mm-hmm.
We do a lot of analysis and commentary, but also some investigative reporting that other media just don't do. And that's why it's called Uncovered. There's so much that I think needs to be covered about health insurance companies that rarely are exposed. So that's one thing. I also, as you noted in the introduction, lead an organization called the Center for Health and Democracy. That's our advocacy arm. And we spend a lot of time in Washington trying to educate policymakers on how the health insurance industry operates. I've often said that I will be making amends for what I used to do for the rest of my life. And that's sort of what I'm doing. I'm not a lobbyist, but I do meet with members of Congress and the staff on both sides of the political aisle. In fact, this year I probably met with far more Republican offices than Democratic offices because they have the power these days. And when I say educate, it is to try to help them understand how these companies are composed these years. As I said, as you know, they've become vertically integrated, and in many cases, the operations that are not health insurance are even bigger. That's certainly the case at Cigna, since it bought Express Scripts back in 2018. That part of the company generates far more profits than Cigna's health insurance division does. So I help people, certainly in Washington and throughout the country, understand what a PBM is. You're not surprised to know that that's not a concept that many people really fully understand, or that the biggest are owned by the biggest insurance companies. And I help policymakers understand, for example, how prior authorization is used in many cases increasingly aggressively by these companies. And also to take a look at the Medicare Advantage program. It's wasteful. If you're overpaying companies $85 billion a year, that's an enormous amount of waste, and it's draining the Medicare Trust Fund. So I try to encourage policymakers to look at this objectively. This does not make sense. We have a healthcare system or system of health insurance, whether we're talking about public payers or private payers, just really bamboozling all of us and fleecing the government, fleecing employers in many cases. I also do a fair amount of public speaking. I've spoken to a lot of organizations that attract agents and brokers, and we've seen each other in some of these gatherings of people
Yep.
who have also, like me, worked in the industry, but uh, got pretty disgusted with what they saw and had to do, and are trying to do things differently in the private sector. And I encourage that. I try to help people understand that we can have a better healthcare system, one that doesn't cost us so much, one that can bring more people into coverage, and but you can't expect Washington and politicians to solve all your problems. And I tell the folks in the private sector, you need to uh, pay attention to the political arena because good and bad things happen there,
Yeah.
and you need to monitor that and to weigh in to make sure that, in my view, that these big companies don't even have more of an advantage.
All right. Consequential things certainly happen there as well. What does
Yeah.
a fixed system look like to you, Wendell?
I think one of the things that we got away with as part of propaganda, and sometimes that, by the way, I've said that looking back, a better title for me would have been Vice President of Propaganda, because I became a pretty good practitioner of that. I understand it's pretty easy to get people to believe things that aren't not true or just half true, to get people to influence how people think and even how they vote, and that's very important for these companies, and I was a big part of that. Um, as I was saying, one of the things that we talked about was the fact that Americans like choice and competition. Those are words that resonate well with Americans. I know this because we paid a lot in research to find out, and we use those terms a lot. They used it, I think, very disingenuously. They being my former colleagues, but I think there can be uh, uh, advances we can make if there can be a real uh, uh, competitive landscape for companies to compete. I think the big companies need to be held more accountable. As you know, they're often referred to as buca, usually derisively, to as shorthand for these giant corporations, and it includes, of course, the Blue Cross plans that are even not that are still theoretically nonprofit, but they're massive corporations, and they all operate regardless of their tax status, pretty much the same. It's revenue optimization, and to make as much money for shareholders if you're a for-profit as possible. So I think if you can restore competition, if you could, some of the Republicans in Congress have called for the breakup of these big corporations, and there's bipartisan support for doing exactly that. On the far left and the far right coming together. Elizabeth Warren and Josh Hawley are co-sponsoring legislation right now that would address the size and makeup of these companies and essentially prohibit their structure. What we have allowed to happen is actually illegal in banking and other aspects of our economy. As these companies have integrated vertically, they're paying themselves. They're self-dealing in ways that we write about a lot in Healthcare Uncovered to help people understand that. It's, in my view, incredibly corrupt. It's mafia-like, in my view,
Mhm.
and in the way that they also control political leaders is mafia-like. So I think my view is that they really should be broken up, and I think that it would be probably too much wishful thinking to think that these insurance would be once again largely on a nonprofit basis. But as I said earlier, I think a big problem that we had, or a big turning point, was when insurers uh, became increasingly for profit, and the slavish devotion to profitability and to meeting shareholders' expectations. But I think that there's a lot of innovation that's going on, and you all know this,
Mhm.
in the private space, in which we need to educate employers more, and help them understand they're getting fleeced by these companies. As I noted earlier, Cigna has long been getting most of its revenue from the insurance side as a third-party administrator. That business is very opaque, as are the PBM. The PBM business is very opaque. We need a lot more transparency so that employers can actually get the information they need that these companies often hide from them. And I think if that can happen, some of these smaller competitors might be able to get some traction. I'm impressed with what I've been seeing in the private sector with some insurers, smaller insurers that are operating, I think, more ethically. They're not listed on the New York Stock Exchange. They're for-profit entities, but they have a different approach, an approach that is more, in my view, more patient-centered and more transparent for employers and for people who need health care.
Yeah. And I like what you mentioned about how you pulled out the example about banking. And in a banking environment, this would be unallowed, simply from the fact that I think if employers, I mean, everything's mindset. When you think something has the value of, if you think health insurance has the value of healthcare, you attribute more value to it than if you thought of a health insurance company as a bank. That's very less emotional, right? Versus like it's connected to my healthcare. And the reality is when Americans get involved in the healthcare system, they're getting involved with more or less a doctor and a hospital and a drug manufacturer, and those are the primary stake. And I'm oversimplifying it, but those are the primary stakeholders in a care delivery system, which isn't the health insurance company. Like, I'm not calling up Anthem to want them to perform surgery on me. Like, that's not a thing. Nor am I asking Express Scripts to manufacture my medication. They're just the bank that's allowing the thing to happen.
Yes.
So I'm really glad that you brought up banking, because I think even just the simple brain exercise of attaching a health insurance company to a bank rather than healthcare, well, it changes the decision matrix altogether.
I agree. And these companies, some of them actually have banks. United Health Group has Optum Bank, which is it's a very big entity. In fact, it has, I think, more of Americans' HSA assets than any other competitor. It's just this is astonishing. In fact, my team and I put together a project this past summer looking at United Healthcare, and we found that it encompasses almost 2,700 different entities, and most of them are not health insurance industry on the health insurance side. In fact, the other thing that I observed looking as I do at their quarterly earnings, between 2013 and 2023, United Healthcare actually had fewer commercial enrollees in 2023 than it did in 2013. And it's largely because they had this great focus on Medicare Advantage, and they became the biggest player in Medicare Advantage. But even when I was at Cigna, I know that I could tell that health insurance was pretty static. It was not a place for rapid growth. And the growth has come from stealing market share, as I was aware even when I was at Cigna. The big companies try to steal big accounts from each other. And you have that. That's how the membership usually, they call it membership, I call it enrollment, fluctuates. But it's not a growth part of these big conglomerates anymore. It's important to them. They're able to self-deal because they have both sides. But it's not where they really focus. And if you look at the profit margins, Optum's profit margins are higher than United Healthcare's. Right. The same is true with Express Scripts, and Evernorth, I think, is the entity that encompasses Express Scripts. Same deal. And at CVS, which has over 9,000 stores and owns Aetna, the entity that contributes more to revenue is their PBM. It's just in Caremark. So it's just incredible how these non-insurance industries or businesses really are bringing in the big money for these companies.
But demographics are against them. I mean, with a 1.6% birth replacement rate, and you've got people opting into Medicare Advantage at 65 or a little later, a little before.
Yeah.
If I'm the head of an insurance company and my job is to grow commercial enrollment, all I have to do is zoom out and say, it's not possible unless I
Exactly.
significantly take market share. And I'm no antitrust lawyer expert, but my question does get raised. Where's the monopoly laws in all this? I mean, you go to some markets, Wendell, I can quote you right now, 15 different home and auto different carriers. And we can write your home or auto with 15 different carriers. In your area, how many different carriers would write a fully insured policy for a 20 life group? I don't know. I mean, it's not 15 or 20. And so at some point you back up and say that they've stolen the currency, if you think about it that way. So we have a currency that's managed by the Federal Reserve, which is neither federal nor a reserve, but it is the currency we use. So when I drive into McDonald's, I can use a credit card, but if I'm going to use cash, I have to use a greenback, right? If I walked up to them with a Silver Eagle round, which today is worth over $50, and tried to buy, my number one Big Mac meal, I would have paid too much because I wasn't using the right currency. Okay. So now if I go into a hospital and I don't have a network, that's the currency, then I'm going to pay too much because I don't have the right currency. They've done what they did at Jekyll Island by commandeering the currency. They've commandeered the way by which you have to pay for your health care in order to get a most affordable price. So they get the most favored nation's contract with the provider, but then they sort of negotiate that in reverse with the participant to say you have to pay through this way. Healthcare, HCA, aren't they the biggest publicly traded hospital corporation today?
Yeah.
Sort of wonder with them why they stay public when everybody else is a nonprofit, faith-based hospital. They're getting no property taxes.
Yeah.
How would you make it as a publicly traded hospital? I mean, you would think as a consumer, well, I'm going to go to the local nonprofit faith-based hospital because they would have lower costs, yet they don't. And so my frustration over the last 20 years of being proximity to this is when you go look at the insurers and say, what's the problem? They always point to the hospitals. The hospitals, you talk to them, they always point to the insurers, and you walk away and go, I bet you they're both in on it.
Exactly right. And I'm glad you mentioned that because that has been the game that's been played for years and years and years. It's a finger pointing. It's them. It's not us. We're the good guys. Everybody else is the bad guy. Hospitals, the drug companies, the insurance companies, they all do this. And like in the Clinton days, they did some of that, but they also decided to work in league with each other to kill the Clinton plan. There's one thing that does give me hope is that there is still that finger pointing, but there is now a great division between the insurance companies on one side and everybody else who is not part of them on the other side. Pharma companies, the hospital companies, the physician practices, they don't like what they're seeing and how they are being treated by big insurance companies. So we're seeing, I think, backlash against these companies, like I saw in the 90s from doctors when these companies began to implement some of the managed care practices that were seen as onerous. And there's a big backlash back then. I think we may see that again. To your point, though, these are largely monopolies. And I'd love to take you guys with me to Washington to meet with some lawmakers to explain, just as you did, how absurd it is in this country when we're talking about health insurance. It makes no sense. And Republicans are receptive to this. They just have historically been really tightly connected to the insurance industry. They all have. Like I said, the insurance industry has given lots of campaign dollars to politicians in both parties. They play them off. They play them like fools, to be honest with you. And But we need to have other folks, other people who understand the industry like you guys do, to explain things to policymakers. We get annoyed with members of Congress and politicians, but they have to know a little bit about a lot of stuff, and they have very little depth of understanding of healthcare. So that's what I try to do, is help flesh that out a little bit.
Well, if Ben and I
Yeah.
go to Washington, we can honestly say we've taken money from the insurance companies legally through our license as commissions. So
Yeah.
it's probably not something that a lot of the legislators can say. But
Yeah.
we don't look for a target on our back, but we just want them to do something to do it better. And two things I think of that could break it wide open. One, local municipalities could challenge their big hospital organizations and say, either you become more affordable to the constituents that we all serve, or you're going to lose your nonprofit status as it relates to property
Mhm.
tax, which would be a death knell to them because they have so much property.
Yeah.
The same thing would happen to a college. Or the second thing, which is more of a Maha comment, is if 30% of the population got uber healthy and didn't need all this service, the system would crumble because they've got too much overhead they couldn't support, and they'd have to consolidate, demonopolize, and figure out some other way to path forward.
Yeah, I agree with you. And I'm certainly in the Maha camp when it comes to encouraging people to do all they can to be healthier, because you don't want to be unhealthy in this country. You really don't. And plus you want to have a better quality of life as you get older. I mean, I pay a lot of attention to my health, and I sadly see people who I grew up with who are no longer here, but others who are just not leading healthy lives. And you're exactly right. If we could somehow influence people to pay more attention to what they do and how they take care of themselves, it could be a big difference. But that's a heavy lift, isn't it?
It is. Wendell, we're coming to the end of our time here, and we really thank you for sharing your journey and your expertise. But before we end our time here, we like to ask our guests two questions, and I'll ask the first one. What is a risk that you have taken that has changed your life?
The risk was testifying before Congress. I, as a reporter, had covered congressional hearings before. I'd never imagined that I would ever want to be or have the nerve to be at a witness table. And I was kind of shoved into doing that. I was told that if I wanted to really make a difference, I would go public with what I knew. And in an important setting like that, I knew that as soon as I did that, I would be pegged as a whistleblower and would not have any opportunities to work probably in corporate America at all, anywhere. But I was done with that. But I think that was a risk worth taking. When you do something like that, you always think of worst case scenarios as being what likely will happen. But I've been blessed. I've had opportunities to do other things that I find much more meaningful.
That's awesome.
Wendell, what is left yet unfinished that you have the resolve to complete?
It is moving us toward a fairer, less expensive healthcare system, and one in which the companies I work for are not the gatekeepers, not playing such a big role in our lives, and how we get healthcare, whether we can afford it or not. I can't be attached to the outcome because I'm a man of a certain age, and I think it's going to take longer than I've got to do this work. But that's the unfinished work, and I'm hoping to inspire others to get involved in this work. I don't think anything is more important, because it just simply isn't sustainable.
Right.
An average policy to the workplace now is $27,000.
Crazy.
And then there's out-of-pocket costs for a lot of folks on top of that. It's insane. So we need to get more people to understand why it's insane. So help us out.
Yeah.
You all
no,
doing a good job.
We're there. And Wendell, I think something that, a word that keeps coming to my mind just around the conversation and around trying to fix something is this idea of just justice.
Yeah.
Of an unjust system that is impacting the United States, an American, in just such a negative way that just you stepping into that. And Todd, even your comment about like, I don't want a target on my back, but it's like, but we care about justice. Like this is unjust. Like something has got to change.
Yeah.
So anyway, Wendell, I
Absolutely
wanted
right.
to thank you. Thank you for your work. Thank you for the risk that you took to shed light on what's really going on. Many of us are just incredibly grateful and thankful to you, and that's one of the main important moments to to move change forward, and that was through your courageous act. So I just wanted to thank you for that.
Hey, Ben, before we go on from that point, I think it's important, and Wendell, you brought it up by saying a man of a certain age. I thought that was a fun way to play it, is that we talked about you being at different places decades ago. And had I interviewed you, or had we interviewed you at that time, you never would have said the same things you're saying now.
Yeah.
Right.
You yourself, you called it, that trip to Wise, Virginia, which was a road to Damascus experience. You had to go through all those things. You had a bit of a Pauline experience, persecuting as well as then trying to bring reconciliation.
Yeah.
That story, more than anything, I think can play to many of the listeners to say, no matter what station you're at, God is working a plan to train you, to educate you, to bring you up, to fortify you for a work that is probably yet still ahead. And the work you're doing today, you could not have done had you not been in those positions and those seats and in those companies. And while I know you may feel just a tinge of guilt for some of those things you did, I think you need to shed that and say, but that was the plan to get to be able to speak as loud and as strong as you are right now, because you're speaking with credibility.
Yeah.
You're not just someone who interviewed a guy who did this. You were the guy. And, Paul couldn't have done what he did in his life had he not had the prior. So I'm grateful and thankful for the prior life you had, and encouraging to people who are in situations today saying, God, I got to get out of this, but I've got to take everything I'm learning and then apply it to the next work. And there's many people within the movement that seem to have a lot of that same story. It's interesting how that, to me, is the similarity of the story.
I've encountered, and I know you have too, a lot of folks who've been somewhat on a similar journey. I can't thank you enough, Todd, for what you just said, and you too, Ben. It's this has really been a good conversation. I appreciate you guys. Yeah,
we appreciate you too, Wendell. And I wanted to thank all of our listeners for joining us for another episode of Risk and Resolve. Catch you next time.